Hello, everyone, and thank you for joining the caregiving session today. This session will be focusing on how to improve quality of life and self-care for caregivers. We'll be getting started pretty soon. I'm going to put a question in the chat, and I just ask that you take a moment to respond to the question and look at the responses of the other attendees. The question is, how is the weather in your life? And we ask that you push yourself to answer this question honestly and to maintain a no judgment zone here. Wendy, I can relate to that. Sticky. Partly sunny, partly cloudy, with occasional hail. Yes, been there. Slightly overcast, foggy. 81 is sunny. Nice, Kathy. Great. Thank you all for sharing and participating. Depends on the day, certainly. We're going to go over some housekeeping slides as you all respond to the question. So there are interpretation services available for those who would prefer to follow this session today in Spanish. To access the interpretation services, there's a little globe at the bottom of the screen that says interpretation, and you can just click on that and select the language you prefer. So Spanish in this case. And I will turn it over to Carmita to say the same thing I just said in Spanish.
Thank you, Chaji. Gracias. Para escuchar esta presentación en español, hagan un clic en el icono del mundo de interpretación que está debajo y ahí seleccione su idioma que fuera Spanish. Thanks.
Great. Thank you, Carmita. Okay, next slide, please. Just ask that everyone take a moment to identify your preferred gender pronouns. You can do this by clicking on the right-hand corner of your box. There are the 3 dots there, and then you'll see a rename option, and just add behind. I'll do it for myself because it keeps disappearing for some reason. You could just add it behind your name, and that could be she, her, hers, he, his, they, them, whatever you prefer. And if you are on a mobile device and unable to rename yourself, please add your preferred gender pronouns in the chat. And just a reminder of our practice agreements. We understand that many of us are at home right now and there can be a lot of distractions. So we ask as much as possible, please try to be present and accountable, and also know we welcome visits from children and pets. Please be brave and inclusive. Take space and make space. So if you find that you're asking a lot of questions and making a lot of comments, and we do encourage everyone to share, please just kind of manage that on your own and just step back to allow other people to share. And on the other hand, if you find that you're not sharing much, we ask that you push yourself in and be brave and allow us to benefit from your expertise and perspective. And then finally, address racially biased systems and norms. We ask that you keep that top of mind as we process the topics throughout the summit. I will pause for any questions. And if there are none, then I will turn it over to our moderator for today, Marcia Quinn.
Hi, everybody, and welcome. My name is Marcia Quinn, and it's definitely rainy in Seattle. I'm co-executive director for Parent to Parent USA, but first and foremost, I'm a parent and a caregiver of my 2 boys with autism and my husband with epilepsy. So welcome to today's session. I know that Taiji and the group know how important this topic is to me personally, and I'm very excited to share with a great panel of ladies. So today's topic obviously is caring for the caregiver, tools and resources. We as caregivers spend much of our time focused on the needs of others, often to the harm of our overall health and well-being. Many feel isolated, alone, and invisible, especially with COVID. In this session, we will explore innovative approaches to improving the quality life of caregivers. We'll discuss barriers to caregivers achieving their optimal quality of life. We'll highlight approaches to overcome these barriers, and then learn about tools and resources that we can apply to our very own lives and communities. But most importantly, we also want to learn from you. So please feel free to put questions in the chat box as we go along. I'll do my best to try to answer them at the end. And we'll try to definitely respect your time and get out of here on a timely manner. So without further ado, I'd like to talk a little bit about the agenda and introduce our presenters. First, we'll hear from Roni Snyder, Vice President of Program with John A. Hartford Foundation. She'll talk about policies and our innovations that support caregiver well-being. Our second presenter will be Courtney Latimer, and she's with Community Health. She's their Equity and Wellness Program Manager with the Henry Ford Health System, who will talk about the employer's role in the caregiver support. And then last, we'll have an interactive session with Natalie Miller. She's a Master Certified Life Coach, and she's going to address the care of caregivers and lead us through some self-care activities in the groups. So without further ado, I'm going to go ahead and pass it to Roni for her presentation. Thank you.
Thanks so much, Marcia. I'm really pleased to be here and to speak with all of you today. You know, I do this for my job, but I do want to add that I have been more and more stepping in as a caregiver personally for my own in-laws. My father-in-law has been diagnosed with the early stages of cognitive impairment, and my mother-in-law, who is his primary caregiver, is really struggling with that on her own. So I just, you know, there are layers of caregivers and caregiving. And it's clear to me at this point that right now she needs more support than he does. So this is for all of you. Next slide, please. So just a couple of words about the John A. Hartford Foundation. We are a private philanthropy. We're based in New York City, but we operate nationally. And we were established by the family owners of what you may have heard of, the A&P grocery chain back in 1929. Over the years, we've spent over $640 million in grants since we started our aging and health program, largely in building a field of experts, geriatrics and geriatricians and gerontologists, and in testing and replicating innovations that are in healthcare and for older adults. Next slide, please. So I mentioned our mission is dedicated to improving the care of older adults. That's what we eat, sleep, and breathe, professionally speaking, every day. And these are the three areas through which we approach that. So building age-friendly health systems, supporting family caregivers, that's us today, and improving serious illness and end-of-life care. Those three things in many ways are integrated. These are not siloed areas. They are very much mutually reinforcing. Next slide, please. So I'm really happy to be here today to give an overview of the policies and innovations that can help improve the quality of life for caregivers. And I'm going to do that by starting at a really broad national level and then moving closer and closer to the individual caregiver level as I speak, and then hand it on to my co-presenters. So first, this incredibly important national development that you may have heard about on a different session prior. This occurred about 3 years ago. The Raise Family Caregivers Act became law in 2018 and directs the Secretary of Health and Human Services to develop the first ever national family caregiving strategy. So it's a strategy that's to identify actions that communities and providers and the government and all of us really can and should take to recognize and support family caregivers. So to support the development and execution of that strategy, there was an advisory council that was created, and our foundation talked with the Administration for Community Living's senior leadership and partnered to develop a Raise Family Caregiver Resource and Dissemination Center. So we reached out to another organization, the National Academy for State Health Policy, to really pick up that work, to support it, and to amplify the work of the council, because we want this to actually not be a report on a shelf. We want to create action to truly make a difference in the lives of caregivers. So that council has approved 26 recommendations and a report that's in clearance right now, and it's going to be presented to Congress this year. And following that, a national strategy or action plan will come out that can help all stakeholders, including those federal agencies and all of the rest of us, to do more to support caregivers. Next slide, please. So we also are doing work at the state level. So there's a lot of activity going on right now. The COVID pandemic has highlighted many of the ways that family caregivers need support. And even prior to the pandemic, there's been growing recognition of the positive impact on state budgets and health outcomes that supporting caregivers through policies and programs can have. So one effort I want to highlight briefly is through our funding of the Center for Healthcare Strategies, in a project supporting learning collaboratives of different states to support family caregivers. We began first in 2018 with a cohort of 6 states that are listed here, and then followed in 2020 with another cohort. One of those states is an overlap, meaning we're bringing them on to the next stage. Caregivers in Iowa are really lucky because they are the state that is involved in both. But really, these collaboratives are comprised of state and private organizations, including things like Medicaid and departments of aging and departments of health and human services, universities, health plans, and community-based organizations. And they're all partnering in new ways to prioritize and ultimately advance family caregiving. So you can see here in this pictograph what some of the policies are that states can enact, from training caregivers to expanding respite, to investing in programs that help family members stay in their own homes. And states have a really key role in improving the quality of life for all of us caregivers. And we, of course, aim to help other states learn from those that are working on this. Next slide, please. So moving from the national and the state level down to the organizational level, I'm going to give a couple of examples of innovations at the healthcare and social service provider level. So these are the organizations in your communities that are critical to supporting caregivers. And there are initiatives and resources that are helping them to do that better. So this is one example here. It's an online repository of evidence-based programs that are specifically, in this case, for family caregivers of people living with dementia. It's called Best Practice Caregiving. We realized that there are a lot of well-tested, proven programs, but they really just offer a fraction of the people who could benefit. So we supported the creation of Best Practice Caregiving, and our goal really is to increase program replications nationally and the availability of these proven programs to families who are living with dementia. So it's a database that's searchable, and it helps provider organizations choose the best programs to meet their specific population by including things like language needs and the ability to provide services, let's say over the phone or via video, which has become incredibly important this past year. So these are some fantastic organizations you should be aware of in what they're doing. The Benjamin Rose Institute, which has done the work for this, and Family Caregiver Alliance, where Best Practice Caregiving is located online. So you can see here, if you want to go to it, if you work at an organization serving caregivers, check out that bpc.caregiver.org. Next slide, please. Another example of innovations at the provider level organizations is a new resource from the Diverse Elders Coalition. So this is comprised of 6 different organizations. You can see them listed here that serve older adults in different racial, ethnic, and LGBT communities. All of these are important communities that merit their own specific attention. And we know that one size does not fit all when it comes to caregiving, and that we really have to have resources to build cultural awareness into the provider organization's understanding and approaches. So again, working with the Benjamin Rose Institute, and in this case, the Diverse Elders Coalition, they conducted in-depth research into the needs of caregivers in these diverse communities and created a curriculum that's based on research, and they provide trainings, which have gone virtual, as well as fact sheets on the different populations in their website. Next page, please. Next slide, rather. So I'm going to conclude with examples of resources for individual caregivers. So that may be any one of you individually who need support to improve your own quality of life. Don't we all need that? And that may not immediately come to mind. So the first is listed here. It's related to the surprising finding that came from an AARP study we funded, back in 2012, that revealed that nearly all caregivers are performing more and more complex medical and nursing tasks, and oftentimes with little or no support or preparation. People are being sent home from the hospital, for example, with the expectation that they'll do work that trained professionals sometimes don't even know how to do. So this finding was confirmed in a follow-up study we did. It came out in 2019, which went deeper into the specific diverse populations and uncovered the kinds of tasks that cause the most stress, like managing incontinence, or even special diets are very stressful for people. So in response, AARP, with funding from several sources, including us, is creating videos that help explain and prepare caregivers for these complex tasks. So you can find their videos on the website, which is listed here, and stay tuned for more videos about preparing for things like a hospital visit and discharge, and how family caregivers can help older adults get age-friendly care. I'm going to go to the next slide because I think I'm running low on time. This is the last example I'm going to share. This is an individual level resource that is coming for family caregivers of older adults, especially those with complex health conditions. We're in a process right now of working with a movement called OpenNotes, which focuses on helping people to have better access and utility with their electronic health records. We are working with OpenNotes and Johns Hopkins to make it standard for family caregivers to be able to have their own access to health records. That's to allow them not just to access information to make your life easier, but also to allow them to be fully recognized and incorporated as members of the care team when appropriate. That's another really important piece to fully acknowledging, supporting, and training all of the family caregivers who are heroes in so many different ways. So my last slide, please, is really just a thank you to all of you for everything you're doing every day. And with that, you can catch me here if you want to find me later. And I'm going to pass the baton over to Courtney, who's going to speak about supporting employers' roles in supporting caregivers.
Thank you so much, Roni, for that amazing information. And again, I'm Courtney Latimer. I am from Henry Ford Health System. I'm a program manager in our Department of Community Health, Equity, and Wellness. And today I'm going to talk to you a little bit about the work that we do with community health workers and how we support them at work. And so next slide. So in Michigan, community health workers go by many different titles that include, but are not limited to, promotore de salud, peer support specialist, recovery coach, community-based doula, outreach specialist, community neighborhood navigator, maternal child health worker, or community advocate. And the the American Public Health Association defines a community health worker as a person who is a frontline public health worker, who is a trusted member of and has an unusually close understanding of the community that they serve. And they serve as an intermediary between health and social services and the community to help facilitate access to services and improve the quality and cultural competence of service delivery. In addition to those two, community health workers also build individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. Next slide, please. So CHWs connect the dots to make truly integrated care happen, and the data has proven that their role improves outcomes. They meet directly with clients, mainly in their homes and throughout the community, and they make CareNet core among various providers or help connect clients to basic needs. They most often live in the communities that they serve, and they share similar backgrounds, as I said earlier. And because most of the work CHWs do in the community, they have the ability to connect with patients on a more personal level than they would then they not be able to without that special relationship. And this is really the crux of what CHWs do, it's relationship. But when building relationships, CHWs run the risk of exposure to secondary trauma, which is defined as emotional duress that results when an individual hears about the firsthand trauma experiences of another. This is why it's so important to have policies and procedures in place to help support people at work that are caregivers. So if you're an employer of a caregiver, it's extremely important to be cognizant and mindful of these types of positions where caregiving is the main job of your employee. CHWs also risk compassion fatigue and burnout. And compassion fatigue refers to the profound emotional and physical erosion that takes place when helpers are unable to refuel and regenerate. And Natalie is going to talk to us after I'm done about some really great ways to be able to do that. CHWs also risk burnout, which is a term that has been used since the early 1980s to describe the physical and emotional exhaustion that workers can experience when they have low job satisfaction and feel powerless and overwhelmed at work. And you can go to the next slide. So we realized at Henry Ford Health System, specifically with the CHW Hub, it's a fairly new program, fairly new coordinated program over the last few years. And so me personally, I've always had an open door policy with my team to have and have been intentional about building a relationship with them individually, as individuals as well as a group. And I build those relationships and gain trust by sometimes sharing my own personal experiences. And I've been able to speak candidly with them and ask questions about how they are feeling. And sometimes they volunteer this information on their own for me as well. But I've had CHW share with me the amount of trauma that they've experienced and how their jobs are taking a toll on them because of that. I've also had CHWs come to me and discuss high levels of stress and anxiety, burnout, and compassion fatigue. And these are things not only that affect their mental health, but their physical health. And it also affects the work that they do. I mean, I've had CHWs who can't help but to help. This specific one, she's so compassionate by nature and has helped people for as long as she remembers. And her heart is very big, but her time is not unlimited, nor her resources. And so she's gone in her pocket to help people, and she's as well as failed to set boundaries in the past. And it wasn't until she was physically sick that she decided to take a step back and prioritize her physical and mental health. And so that is when we began to strategically and intentionally integrate self-care and other things that I'm going to talk about in a minute to ensure that we are carefully caring for the people that make sure that our patients, that care for our most vulnerable patients. Next slide. So what does CHW support look like at Henry Ford Health System? So again, we've been strategic about having trauma-informed care and ensuring that our CHWs don't face burnout as much as we can. We've developed a community health worker hub, which allows for professionals who worked in community-based organizations and in public health and policy for many years to manage, supervise, and create protocols and job descriptions for all the CHWs within the system. CHW Hub, we serve as an anchoring unit for the standardization and deployment evaluation of CHWs throughout the system, so that they're able to promote a culture of wellness throughout enhanced care coordination. And we ensure that our CHWs are a valued part of the healthcare, are looked at as a valued part of the healthcare workforce, and taking a population-based approach to extend care beyond hospital walls. There are things like goal setting and protocols that are deliberately worked into a CHW's job description, which allow for clear understanding of the job at hand. And a lot of times in autonomous positions such as CHW work can be stressful to those who need more structure. So by allowing the CHWs to be independent, but have a tight, clear protocol and procedures, we try to ease some of that stress that can come along with not having a clear path or objective in your work. And so the basis of our support is always a clear path, protocols, job description, something that CHWs can look at and touch and say, I understand my duties, I understand my job. Next slide, please. In addition to policy side, which we heard some about from Roni about policies and other ways that an organization can put policies in place for self-care. CHW need access to supportive, flexible manager who's wide open to regular workload assessments in order to reduce trauma exposure. They need leadership from a manager who encourages staff to attend ongoing professional education, and and they need leadership that provides timely and good quality supervision as needed. Employees you can go to the next slide. I have one left and then my time is up, and then we're going to hear from Natalie Miller. But I just wanted to say that some of the challenges that we've had in the past is really getting CHWs to express their need for help. They're so used to being helpers that they don't really like to ask for help. I have to like make them and remind them to set boundaries so that they feel boundaries that they feel won't interfere with their ability to help patients. Sometimes they feel like setting boundaries will do that. And we face a lack of resources in the Metro Detroit area sometimes, which make it hard for them to do their jobs. But being patient and listening to CHWs has been extremely helpful in trying to mitigate some of these challenges, and obtaining training and knowledge about compassion fatigue on my end, and burnout and secondary trauma. And also I encourage self-care at every stage, and I provide them opportunities to learn from each other. And so those types of things we try to do to make sure that our caregiver workforce stays motivated, takes care of themselves. And we're going to hear a little bit from Natalie Miller next about how to really take care of yourself when you're a caregiver. Natalie, take it away.
Okay. Hi, everyone. I am so glad to be here, so honored to be here with you, and super excited for a slightly more interactive presentation. My part of the presentation will be slightly more interactive. So if you would like to get your typing fingers ready to be chatting with me, that'll be wonderful. And I also want to give you a heads up. We will be having some breakout sessions during my portion of this presentation so that you can talk to fellow caregivers, fellow people who are interested in supporting caregivers. And so just a heads up that you'll have a breakout opportunity coming up soon as well. So I'm Natalie Miller. This is self-sustenance for caregivers, and that's actually what I call it. I call it self-sustenance rather than self-care. Self-care sounds lovely, but self-sustenance is really, I think, more what it is. Next slide, please. So I'm Natalie Miller. I am a master certified life coach. I am an intersectional feminist, which basically means that the people I coach are people who are trying to make this world more equitable, more inclusive, and more honoring of the reality here on planet Earth, which is that humans need care, and our structures are not always built to serve humans. I am also a caregiver. Right now, I'm a caregiver of my two daughters who are 11 and 13, but I also come from a matriline of caregivers. And so I think a big reason that I'm here actually is watching what happened in my family, in my own family, with my mother and grandmother's caring of my grandfather. Next screen. So, or next slide, please. So here you get to see me in a very cute hat. I'm there in the back, right behind my grandpie. That's my grandpie. And he had a stroke when I was 7 years old and lived for a decade, unable to speak, unable to walk, unable to communicate. We really were never able to find great ways for him to communicate with the family. And my mother and grandmother were his primary caregivers in a very small town in rural New Mexico where there weren't a lot of community services. And so I saw and experienced firsthand both what can be delightful and heartwarming and really fulfilling about caregiving and also what can be really challenging about caregiving. Okay, next slide, please. So oftentimes what we hear when we hear people talking about caregiving is we hear people say, oh, you know, you've got to put on your oxygen mask first and then assist the person next to you. But I actually don't think that this is the best metaphor. Actually, tell me in the chat if you've heard that before. Have you said that to someone, or has someone said that to you? You know, oh yeah, you got to put your oxygen mask on first and then you assist the person next to you. Maybe you've heard this before, this metaphor. Yeah, we hear that. Yeah, we've heard that. Yeah, just breathe, right? Okay, good. Excellent. Okay, so next slide, please. So I'm going to say, actually, caregiving is not really like being a passenger in a depressurized plane, right? It's not a one-time thing. It's not a big emergency situation. It's ongoing. It's ongoing. It is more like being the driver, I will say, on a long road trip. When we have careers in caregiving, or when we're caring for loved ones who are dealing with various conditions or diagnoses or whatever, like this is a longer thing. This is not a 5-minute thing. This is an ongoing thing. Next slide, please. So I want to honor that sometimes, as I said earlier, this journey is beautiful. This road trip there is beauty in it. There is sweetness in it. There is, we can access some of the meaning of life in caregiving. And I want to ask you, when caregiving is lovely, and especially when you are feeling supported as a caregiver, how does it feel? How does it feel to you? I think to me, the word poignant comes to mind. It can feel very, very sweet, very, very poignant, fulfilling, beautiful, rewarding. Yeah, gratifying. I feel gratitude, like a warm, comfy bed. Yes, it can be so lovely. Okay. And so when it feels that way, next slide, please. We are popping along. This is one of my favorite GIFs ever. I love this one of our First Lady, Michelle Obama, and Missy Elliott. So it can feel really fun, actually. Maybe when we've got like we've found a new program or some peers, or we've just had a really good day, right? Sometimes you just have a really good day and it feels really, really good. Okay, next slide, please. So when you are well supported in your caregiving, when you have a full tank, what I'm hearing is that you feel grateful, you feel fulfilled, you feel like warm and cozy. Is there anything else that comes to mind? Like when things are good, when you feel supported, how do you feel as a caregiver? As I'm approaching this from proud. Yes, I love that. Yes, proud, like capable, powerful, right? Confident, like a hero. Oh, Courtney, I love that. Yes, like a hero. Absolutely, as well you should, right? You know, what Courtney was saying about, I have these people, these community health workers who have huge hearts. Like this is fabulous work. And yes, it's challenging, but there's beauty in it. There's beauty and there's power in it. Relaxed. Yeah, beautiful. Yeah, we can just be present. I love that. Okay. Now, of course, we know that the caregiving journey is not always simple. Next slide. Sometimes it feels like this. Sometimes it is like a winding road, and where is it even going? And I'm a little bit nauseated. It's a roller coaster. I don't know what's happening next. Where is the end, right? And then next slide. The gaslight comes on, and the gaslight, my friend, is your gaslight. You haven't slept, you're exhausted, you're burned out. Exactly, crash and burn. All of the things that Courtney was talking about too, right, in her presentation. I've got compassion fatigue. I've been re-traumatized. Like I'm out of gas. I'm out of gas. Okay, next slide, please. So how does that feel? Well, in my experience, sometimes there's this. I've got like fear and anxiety. Next slide. Sometimes, and this is very likely for me, I get very irritable. I get very, very irritable when my gaslight is on, when my personal tank is low. As a caregiver, I get very snappy. I have a short temper, a short fuse. I get frustrated easily, personally. Okay, next slide. Sometimes we get like just discombobulated, and we make mistakes. I've seen this a lot. My mother actually is a nurse, and I've seen this, you know, like we get the wrong medication out, or we don't wrap the wound well. Like there's all kinds of little mistakes that happen. You can see this woman is shifting with a Coca-Cola bottle rather than a gear shift. And then finally, next slide, sometimes we're just despair. We're just tired, and we're sad, and we're overwhelmed with a despairing emotion. So next slide. Which direction does it tend to go for you when the caregiving road gets tough, or when you are running on empty? How do you feel? How do you show up? And my friends, I know that we don't know each other, and this is kind of a vulnerable question. You're welcome to just reflect on this for your own, but yes, stressed out. So when we share with one another, though, it's really powerful. Unfocused, easily irritated. I need to withdraw. Yeah, irritable, foggy, emotional, anxiety, resentment. Thank you so much for sharing. Despondent, irritable, emotional. Yeah, ooh, resentful. Boy, I feel that one too. I forget to eat, sleep, etc. I lose capacity to care for myself. Yeah, irritable and despondent. Absolutely, absolutely. I isolate. Okay, excellent. I'm mad. Yeah, totally, Kathy, mad. Okay, next slide, please. So when you feel that way, how do you show up? We heard a little bit, let's see, we heard from Karen, I don't take care of myself. What happens for you when you're feeling mad, irritable, despondent? What happens for you? So for me, I snap at the people I love and I'm trying to take care of. That's what happens for me. I shut down. Yeah, I shut down. What else happens? I shut down, I break down. Yeah, I lose it. Absolutely. Yeah, sometimes I'm not nice to my loved ones, and sometimes I don't take care of myself. Yes, very honest. I become someone I don't like. I'm uninterested. I'm quiet and withdrawn. I'm withdrawn. Yeah, absolutely. I'm lazy. I get really, yeah, I lie around. Totally. I'm empty. I'm unable to show up. Thank you so much for sharing. So my friends, what I find is that encouraging a caregiver to take care of herself or himself is lovely, but that's not where caregivers' motivations and inclinations tend to lie. Where they tend to lie actually is with giving care, with being generous. And so really what helps is to recognize, oh, when I don't have support, I don't get to show up in the way I want to show up. Not because I'm short-tempered, bad, wrong, any of those kinds of things, right? But rather because my tank is empty. So I've got to take care of myself, right? Kathy, oh, good. Yeah. So we're coming right around to that. Perfect. Thank you for that segue. Right around to what can we do? Okay, next slide, please. So caregivers need fuel. This is the point of my presentation. Caregivers need fuel. And as I want to talk just a tiny bit about what that might look like, right? Here we go. So Kathy's let us know, like talking to other people and having people listen is really helpful. Next slide, please. What is fuel for you? Next slide. Sleep. Alone time. For me, alone time is like number one. Talking to peers. Spiritual practice, receiving services, but really receiving services, like even allowing yourself to not be there when you're getting help, when you're receiving services, reading, exercising, excursions. Oh, Chesney, thank you. Yes, validation, words of affirmation, quiet, right? Just some peace and quiet. What is fuel for you? This is the question we'd like you to take into some breakout rooms. Next slide, please. So what we'll do now is we're going to set you up in little rooms where you can hang out with other people. Okay. Yes, mental health therapy. I love that. So what we don't have hours. And by the way, the breakout sessions are very fun, and they also tend to go by in an instant, right? So we're going to depend on you to make it so that everyone gets a chance to talk and everyone gets a chance to share, right? So you'll share your name. You'll share what fuel is for you. What do you know is really good fuel for you? And then what supports you in getting that fuel? What supports you in getting that fuel, right? Optionally, you might also talk about what are some of the things that get in the way of you getting that fuel. So for example, if I really need alone time, I know I need alone time. What will support me in getting alone time? Well, maybe asking for help from a family member, maybe hiring a babysitter for an hour, right? Maybe allowing my children to be watching a television show while I just go in the other room, and I don't want them on the TV, but I let them be on the TV so I can just have some time to myself, right? That's what might support me. What keeps me from that? Oh, it's not a big deal. I'll just stay. I don't need a sitter. I don't need help, right? That's what keeps me from that. So you might talk about that in the breakouts as well. So you're about to get an invitation. The invitation is going to say, here's a breakout room, and you'll accept the invitation. So you'll be magically whisked away into a room with some other people. Again, you're talking about your name, what's fuel for you, what helps you get it, and what gets in the way of you getting it. Maybe you'll get some ideas. Certainly you'll get a little bit of camaraderie. If you are using interpretive services, please don't accept the invitation for the breakout. Stay with us in the main room, okay? So the rest of you, if you're not using the interpretive services, feel free to be whisked away, okay? Excellent. Okay, and we'll just see if anyone is left here with us. There may be a few people who are not popping into the breakout rooms, but if you haven't received the little we're inviting you to a breakout room yet, you can let us know in the chat and we can try again for you. And if you prefer not to go into a breakout room for some reason, I encourage you to answer these questions in the chat, and I would be happy to be with you here as a coach. Okay, so curious, what is fuel for you? Oh, and yeah, it's fine if you don't have rest. All right. Well, thank you so much, everyone, for thinking about care on that most personal level, and thinking maybe now in our Q&A about how we can take that, the sort of understanding of what we need on the personal level, and then to think about it more broadly in terms of what's the support that we can then find perhaps in our communities, at the community level, at the state level, at the policy level.
Thank you, Natalie. That was very helpful for me. I know that, like I said, especially during COVID, I miss humans so much. I mean, we spend so much time on Zoom, and that's the only interaction that we're getting at this point in time. But I agree with everything, making time with your friends, putting it on your schedule, slotting time, that obstacles that are getting in our way. For me, it's, I'm not eating well, I'm not exercising, I'm not doing all the things that I know that I need to be doing. And because I'm sleeping more, or I'm strapped with time with my son. You know, he's 22 now and he's not in any services. So I'm full-time caregiver plus taking care of him. So at this point in time, does anybody have any questions for the presenters? I think it was a really well-rounded combination of policy, employment, and then the self-care that we talked about. I'm gonna switch over to my chat box. It's hard to present and chat at the same time. As you guys know, I was giving people their cues for timing. Any questions? You can also raise your hand and come off of mute. We have, you know, about 8 minutes to go. So this is a time when feel free to open up and speak out. I see here that this, you know, when you live with children who need care and then you also do this to support families professionally, I mean, that's got to be a double. That's Kathy Salager. That's a double whammy right there. The fuel that drives me is quiet time. I don't know that I get enough of it, but it's something that is not in my household. It comes very seldomly. So I love it that COVID's starting to lift a little bit so I can go to a coffee shop and actually work and be around humans, even though I'm not talking to them or hanging out with them. So Lauren, thank you. She's thanking Natalie. She feels better already with speaking to a group. I think this is a comfortable space for you to talk or share at this point in time. Suzanne again said, I wish I could give the level of care that I give to my families and others, which is why we're all here and we're having this breakout session. But I also commend you for giving that level of care to the families that you serve. Clearly it's important, and that's what this entire summit is about. Do anybody of the presenters or anybody have any closing comments or sharing that they'd like to provide at this point in time?
I guess I will just say that I really loved the breakouts that Natalie set up and the lead into those as well. Natalie, I think that was the kind of therapy we all could use and none of us get enough of. And you had just the right touch. You know, we at the Johnny Hartford Foundation work at such an operational level as opposed to the individual level, and it's really lovely to see the individual touch as well.
Absolutely, and I think, like you know, I don't get to work directly with families at Parent to Parent USA. Thankfully, there's multiple staff across the country. But I do have, I think a lot of us have a personal experience, and that's why we're here. So it's kind of nice to have that combination of all of the above, you know, striving for the same goal. It's community health. Let's see, Teresa said something, making space for community health workers and similar staff due to rigid structures within the healthcare system. I know I've heard that that's a really big challenge. And they want to know, Courtney, maybe about how you've navigated that at Henry Ford, how you've dealt with the system with serving people at the same time.
Well, the biggest advantage that we have is that our senior leader is the Senior Vice President of Community Health. You may or may not have heard her name is Dr. Kimberly Dawn Wisdom, and she was Surgeon General for the state of Michigan for a few years. But she is a big advocate for community health workers. And so because most of our community health efforts fall under her, we already have the buy-in from the senior leaders. And so we're able to navigate the system a little more because, you know, I'm certainly one to always drop a name when I'm trying to get something done. I'm not ashamed of it, and I'm going to keep doing it if it's going to help us do what we need to do. And she encourages that. And so I think, you know, that is really an advantage that we have, is having the buy-in from senior leadership.
Great. Does anybody else have any questions? The recordings will be shared after the summit. And the slides and the recording. Are there any other questions before we go ahead and close out for the day? Great. Well, I think the gift of time is always amazing. So we've given you a little 4 or 5 minutes to go take a break and take care of yourself, do something nice, have a cup of water or coffee or tea or whatever your treat or your fuel is. I'm so delighted to be amongst great people and a great chat. So thank you so much on behalf of Health Leads and the Caregiver Summit, and enjoy the rest of your day.
Thank you, Marsha. And thank you to the panelists. This was amazing. I know I certainly needed it, and it seems like many in our audience needed it as well. If everyone could take a moment to complete the survey for this session, we really look forward to your feedback and use that as we develop sessions in the future. And we now have a 10-minute break, and we'll come back together at 4 p.m. Eastern, 3 p.m. Central, 1 p.m. Pacific for the closing plenary. Thank you, everyone.